I'm Dr. Shalini, MS Gynecologist and also DNB Gynecologist. Today we are going to discuss about IVF. So what is actually this IVF? IVF means In Vitro Fertilization. So what happens normally in natural pregnancies, fertilization occurs inside the body and they conceive naturally. But in certain individuals who are not able to conceive naturally, there should be a certain process which is we call now in vitro fertilization. Here, the fertilization occurs outside the body, that is in separate dishes in a laboratory. And then after formation of these embryos, we transfer them into the individual. So we collect the eggs, or we call them as oocytes, from the female, that is sperms from the male, and fertilize them in a separate dish or separate container, and we make them embryos for about 4 to 5 days in the culture. After that, we transfer these embryos into the body and then the patient can conceive. So this is the process is occurring outside the body, and the fertilization, everything, whatever process required for the formation of the body occurs outside the body. That is why we call it as in vitro fertilization. So generally it takes about 5 to 6 months of time to achieve pregnancy in IVF, because here the individual has to be prepared for the IVF. It takes about 1 to 2 months because the follicles has to get uniform. When we do on day 2 scan, the follicles should be of uniform size to start the stimulation. Stimulation means giving injections to increase the number and also increase the size of the follicles. So it takes about maybe 1 to 2 months. And once the stimulation starts, it takes about 10 days of injections regularly. And on 12th day, we retrieve or we pick up the oocytes from the female under anesthesia, and then we prepare the embryos by taking the sperms of the husband on the same day. And again, to transfer these embryos, generally we go for the frozen embryo transfer. This is because when ovaries are big, they may lead to ovarian hyperstimulation. That is, ovaries may become big and the patient may have discomfort. So we generally prefer to freeze those embryos, and these embryos will be transferred in the next 1 or 2 cycles if the endometrium is good. So overall, it takes about 4 to 5 months for an IVF cycle to get complete and the patient to become pregnant. Who are the candidates who are eligible for IVF? Are we advising IVF to every client? No. Then who wants this IVF? So in vitro fertilization means because the individual has not able to conceive. So what are the factors or what are the indications? Rather than this qualifies, we can tell it as indicators. What are the indications to say that a couple requires IVF? The first important one is tubal factor. When the tubes get blocked because of some reasons, maybe pelvic inflammatory disease, or already the patient has some infections or any tuberculosis, all these infections may cause tubal damage. Once the tube gets damaged, embryo cannot be formed. This is because the egg which is released from the ovary, it has to be taken up by the fallopian tube, and the sperm which enters through the uterus, cervix uterus, it has to enter the tube and the fertilization occurs. So the fertilization ultimately is taking place in the fallopian tube, that is tube which is present beside the uterus. When the tubes are blocked, the fertilization will not occur and the formed embryo will not go and implant into the uterus. Therefore, tubal factor is one of the causes, the most important. It accounts for 15% of the total IVF indications. Next, coming to ovarian factors. So we have seen in the last class endometriosis, PCOS. In those things, endometriosis, which involves the ovary, it forms endometrioma and it decreases the quantity of the egg. And in PCOS, what happens? There are multiple follicles. No follicle is allowing the other follicle to grow. So when the follicle doesn't grow, there will be no formation of the egg. There is no rupture. There is no baby formation. So in ovarian factors, again, which accounts for 12 to 15% of the total IVF cases. So tubal damage, ovarian factors, and now coming to the age related. So because in recent years, because of the career or any other factors, the females are generally wanting the pregnancy in the early 30s or maybe in the late 30s by the time the egg reserve might have been decreased. So in such cases, when egg reserve is decreased, egg reserve means number of follicles when they are decreased. So if we again tell them that naturally or intrauterine insemination, it takes time, and as age advances in female, the number of eggs decrease as well as the quality also decreases. Therefore, age related is also one of the issues where we have to suggest IVF in a female. Now coming to the male. So in male factor, generally the count should be 15 millions per ml and the motility should be more than 25%. So when a person has decreased number of sperms and decreased motility, so we have to advise this in vitro fertilization. And the other than this, unexplained. So this is very common, like maybe 20 to 30%, because individuals they come, we try naturally, ma'am, everything is good, tubes are good, egg is getting released in the each month, and sperms, the quality, everything, semen analysis is good, but still we are not able to conceive. So that is we call as unexplained infertility, where the quality matters, because in all these cases we don't know how the quality of the egg and quality of the sperm in natural cycles. So in such cases of unexplained infertility, we can suggest IVF. So in a nutshell, any tubal factor, ovarian factor, age-related female factor, and male factor, and unexplained infertility. So these are the indications where we advise a couple to go for in vitro fertilization. This takes about I told actually the 5 to 6 months of time, because we have to prepare the cycle to start the stimulation. So when we start stimulation means giving injections in a, it is controlled ovarian hyperstimulation we tell. So we give injections in such a way that to increase the number, and also increase number means we are not increasing the number as such. Whatever the individual has the follicles, we make them increase in size, and also all the follicles will be recruited by giving these injections. So daily we give almost 10 days of injections, where the client has to take every day, daily at the same time. And we also have alternative scans to monitor whether the client is responding to the injections or not. And we also do some tests to see that whether again she's responding or not. After 10 doses of injections, generally the follicles should be about 18 to 20 of size. When they reach that size, we give trigger injection, because all these 10 injections we are giving only to increase the size and to increase the to improve the maturity and to improve the quality, everything. Now we have to make them release. So we have to give trigger injection after 34 to 36 hours after this trigger injection. And the patient will advise NBM, means she should not have anything by mouth for about 8 hours. And we give general anesthesia. In such anesthetic conditions, we retrieve the oocytes from the female, and on the same day we ask the husband to give the fresh sample, and then we prepare the embryos. So these embryos will be frozen. So now we have seen it is almost taking about 3 months of time. And if we go for the frozen transfer, we have to see the endometrial lining. That is very important thing, because if endometrial lining is of good quality, we call it as triple layer. 3 layers should be there, and also zone 3 or zone 4 blood supply to the endometrium should be there. We all these things can be seen in the scan. So when we confirm all these factors are there, then we will transfer the embryos. After transferring the embryos, 15 to 18 days, we will advise the blood test. Then we will come to know the results. Again, second blood test to know how the baby is growing. Then we do the scan. So it is almost 2 months. So it is almost taking about 5 months of time for a complete IVF cycle to occur and a pregnancy to achieve. Sometimes in individuals, like I told, if more than 35 years where egg reserve is less, they may require 2 stimulations also. So in one stimulation, we may get 2 or 3 embryos. Again, we have to advise one more stimulation, maybe 2 or 3 embryos. So that is called pooling of embryos. So out of this 4 or 6, then we go for the frozen transfer. In the transfer, we open the two leaf. We store the embryos in a leaf. So we call it as cryo leaf. So we open those 2 cryo leaves, and if we see whatever good embryos are there, then we will transfer to the patient. So sometimes it may take about 7 months of time also. And suppose if the endometrium of the client is not good, so we have different types of protocols to improve the endometrium, or sometimes we may also advise hysteroscopy. Hysteroscopy is like we are seeing the uterine cavity under vision, that is through the camera, and there will be a monitor to see this. They will be monitored to see how is the uterus inside, why the endometrial lining is not good. And we also send a biopsy to see any infection present or not. So again, it may take sometimes 8 or 9 months. So depending on all these factors, if everything is good, if she's like 28, 32, 33 years of age, everything is fine. So maybe she may require 3 to 4 months of time. If she is aged individual, like more than 35 years, and the quality of embryos is little bit less, maybe we have to go for 2 stimulations. In such cases, 4 to 5 months of time. If endometrium is not good, we may take about 7 to 8 months of time. So ultimately, we should give success to the client. That is our motto. Success rate is about 50 to 60%. Because in IVF, already the individuals might have gone many treatments and they have reached us a state where the egg reserve is less or any other factor which is not treatable also sometimes. So that's why in such cases, or in most of the times, it is about 60% success rate. If aged individual like more than 35, again, because I'm stressing the age because in this era, many clients, they try to conceive only after 30s, and they try naturally, they try IUI something. If they don't work, if it doesn't work out, then they go for the IVF process. So in such cases, it may be 40% also. But however, now we also have an ICSI. ICSI is a little bit superior to IVF in male factor infertility and also in low AMH, in low ovarian reserve. In such cases, we can do ICSI, which improves the success rate to 70%. And in sometimes, if you still further you want to 80 to 90% achieve, so we can do embryo biopsy. That is, we know that the outside embryo is good. We call it as blastocyst. So generally, we do blastocyst transfer. That means that it's a good embryo. Still, outside, though it is good, there are genetic problems to the embryo. So how to identify those? We do pre-implantation genetic diagnosis. That is pre-implantation. That means before implanting the embryo, we take an embryo biopsy and send for the genetic analysis. If the embryo's genetic analysis is good, then we are going to the transfer. In such cases, it will be like 80 to 90% also. So on an average, the success rate varies from 60 to 80% in an IVF, ICSI, and also pre-implanted genetic diagnosis IVF cycle. To improve the quality of this, since the clients are going this much painful process, all this 1 or 2 months, because injections, everything, so they have to take at least good protein diet 1 to 2 months prior to starting IVF process. Because if egg quality improves, when there is a good quality, like protein diet they should have. So they like daily 1 egg, 1 glass of milk, fresh fruits and vegetables, less amount of oil, less amount of sugars, processed foods, and they should also decrease weight if they're like obese or overweight, because decreasing the weight also improves the quality of the oocyte. Even in males also, they should have proper diet, and generally almost all the software jobs, IT jobs, they may have shift spice. So in such conditions, we generally advise them to have a proper sleep of about 7 to 8 hours, and they should have daily walking, daily protein diet, and again antioxidant rich food, that is fruits and vegetables. They can have non-veg food also, but less amount of oil, less spices. So generally, we advise all these lifestyle modifications and dietary modifications at least 2 months prior to the IVF, and also continue throughout the IVF process and in the pregnancy to the female.